Here we have the images of kidneys, ureters, urinary bladder, the prostate as well as the urethra. You have two kidneys here. The one on the left has actually been cut into section so that you can see the inside. Okay, so two kidneys, then you have ureters coming out of the kidneys. They're like pipes coming straight down and going into the urinary bladder, just in the lower portion. Now, once urine is in the urinary bladder and there's an urge, to urinate, of course, the urine will come out through the urethra, which is also like a small pipe that goes through the prostate and then goes through the penis so that the urine can come to the outside. You can also see the uterus just on top of the urinary bladder here, and you also have the image of the prostate.
Hi guys, how are you all doing? Today is going to be about prostate ultrasound. It's going to be about the guys. Okay, I'm going to talk about an incident that happened then when I was walking in the north, and shortly after youth corps. Okay, I worked as a medical officer in the emergency room. An elderly man walked in. In fact, he was crying. He couldn't pee and needed help at that time. So I just realized that, okay, this man he was in pain. You can imagine having full bladder and not being able to urinate at all because of blockage, kind of. He was crying, the elderly man crying. So I brought him in. So what I did for him basically was to pass a tube, what we call catheter, pass it through the penis directly up into the bladder. Okay, so I connected the tube to a urine bag. Okay, so immediately the urine just started flowing out. The man heaved a sigh of relief. He was profusely thankful. Profusely thankful about it. He was having prostate enlargement. Okay, that was the issue then. Let's just fast forward to now. I had a patient not too long, elderly man too, today. Not prostate, became a prostate issue. So I had to do a scan for him, prostate scan. Because when we do prostate scans, we also take it a step further to check the kidneys and the ureters. The whole setup is more like you having two kidneys, and then you have pipes, two pipes coming down, leading to the bladder, the houses the urine. Okay, so you can imagine if there's a blockage of the pipes, that means urine would not be able to come down into the bladder. Okay, now that bladder, just at the lower part of the bladder, that's where you have the prostate. Okay, there's another pipe that runs through the prostate, down through the penis. Okay, so the penis has got its own pipe, called that one urethra. Okay, that pipe, from prostate to the penis has 4 different parts, but let's just call it urethra. The one in the prostate is called prostatic urethra. So we have the prostatic, the membranous, we have the penile, penile and bulbous. So there are 4 parts to it, but you can call it just the prostatic, the urethra. Sorry. So what do we do for patients? Basically, when they come in, we ask them to take water and be pressed, because without the patient being pressed, we won't be able to see the prostate. Okay. So what we just do, so once they're pressed, we bring them in for the scan, and then we'll do the ultrasound scan. We'll check out the prostate and make sure that's fine. And if it's not fine, then if it's big, we take the size, the volume as it is. Okay, and then the baseline I use is 30, some 30 centimeter cube. It's equal to 30 grams, basically. Once it's over that, some other people actually use 40 for older people. Now, you can have younger guys, having like 15 centimeter cube to 20, 25. They're still good. But anyway, as one approaches 40, you just have to begin to do routine medical check. Check your prostate yearly. Just check how it's doing. But so anyway, the patient I saw today had about 95 centimeter cube. That's quite huge. So I've seen like 150, in fact more than that before. One of the things we'll tell them to do aside this now is to do blood test, check for PSA, prostate specific antigen. Okay, so the value we put it side by side with prostate enlargement. So, and even though the PSA is not specific just for prostate enlargement, you could also have a prostate cancer. So there are 2 differences, and there's a way we check, we'll check the 2 prostate enlargement. The one we usually check for, which is the benign one, call it benign prostatic hyperplasia, BPH. That's the benign one, meaning that there's no cancer. The other one is cancer. We just call it prostate cancer. So there are ways we look at them. But the benign one, basically, we look at the outline of the prostate. Apart from the fact that it's big, huge, we'll look at it, and then we'll check out some other things too. All right, if we see that the prostate is big, the next thing we'll go ahead to do is to measure the urine content of the bladder. Okay, it's called pre-void. We want to know the pre-void urine volume. Now, and after that, we ask the patient to go urinate. So then it comes back, and then we assess what's remaining. Okay, call that residual urine. So post-void, we'll check for post-void urine volume. Apart from that, we also do the urinary bladder wall thickness. We'll get that measurement too. So basically pre-void, post-void. Now for the post-void, what I use is a baseline of 100 mils. So if you have urine that is less than 100 mils inside the bladder, you're good. If it's more than that, then that's quite significant. And why are we basically doing that? I want to check for the urine content. If there's plenty urine, even after urinating, and you still see, you can actually begin to gather infection, because there'll be stasis. Stasis just means when you have urine collecting somewhere, staying somewhere for some time, infection can set in, and the patient can also have infection, within the bladder. I've been able to talk about prostate enlargement. I've been able to, and I mentioned that the enlarged prostate could actually be benign, BPH, benign prostatic hyperplasia. So anytime you hear that, just know that it's not cancer. Then the other one is prostate cancer. I've also been able to talk about the ureters, those pipes from the kidneys. If they are blocked, it's an issue. That means urine will not be able to come down. So urine goes up into the kidneys, and it can actually begin to damage, the kidneys. And you certainly don't want that. So you have to find a way of removing the insult inside the two pipes, the ureters. Hope I've been able to give us some information about the prostate. Make sure that once you approach 40, and you just start doing your regular annual checks, prostate scans. This is for the guys. And then if the ladies are watching, probably tell your man, your dad, the guys around you, let them have their prostate checked. All right, see you guys in the next video. But before then, make sure you like this post, okay? And if you have not subscribed, subscribe. Okay, turn on the notification bell icon. Okay, then you can share. See you in my next video. Bye.